Hi John, Dr. Gregish here. We're taking a look inside your hip joint. Here I'm just establishing my portals still, so take this knife and kind of cut the capsule a little bit. We have a little more room to work just like that. Do the same thing in the other direction here. It's a little bit of your labrum. You see on the left just a little bit of fraying of it there. I don't think that that's the big tear causing your cysts though. I think that's a little bit more medial. And so we're going to open up the capsule and get to that. So John, this kind of looks like your labral tear right in here. Okay. You see this fraying there and how it's kind of detached there. That looks different from over here a little bit more medially where the labrum's firmly attached. Show a little different view of that. We come back around here, this part of the labrum looks good. That's going towards your posterior labrum. Cartilage on the humeral head looks good, okay. And the cartilage on the socket really looks quite good too. I'm not obviously seeing that cyst that we saw in the MRI, although there was kind of this glob of bloody tissue in the joint when I went in, and I think that I've already shaved out, and I think that was probably it. This stuff here is your ligamentum teres, I'm pretty sure. I don't think that this is a cyst here. This is a normal ligament in there, so I think we're gonna basically prepare this tear here a bit and get this repaired. And that should keep a sort of cyst from forming again. You can see a little bit of roughness of the labrum right there also. We'll get that cleaned up for you. So here I'm trying to expose the area above your labral tear to get it ready for repair. Basically just pushing the capsule back a little bit. Making sure there really aren't any bone spurs. It doesn't look like it. Your bone here really looks pretty normal. I think this is mostly due to your psoriatic arthritis. Your labrum's a little bit big. So again, this is kind of the area of diseased labrum, at least one area of it. You can clearly see that it's kind of got some undersurface detachment there, although it's not a full thickness tear. So the way that we're going to fix this is by taking down the remaining labrum, because it's not a normal labrum. Come in with a special knife for that purpose, like this. Basically just carefully elevate it off the edge there, bring right up next to the bone.
Hey, Claire, I'm not getting me a mallet. Yeah. Can we have anything?
That tissues there is really pretty flimsy.
I did.
Clearly not normal
I didn't grab
tissue.
it.
And there, I think we're
I was going to open the
just about
orifice.
through there. Okay, I'll come back in with our probe and see how we're doing. Not quite all the way through yet, but just about. So we'll take our knife again. Loosen that up a little bit more. Right in there. Oh, now I can actually see our knife there on the other side. Now we're going to bring in our probe. We should be able to see there where labrum is completely detached now. Right up here, there. That's right in the site of our injured labrum right there, so that's exactly where we want to be. And that makes sense, you know, it didn't take very much to detach this little bit of residual labrum. It's more strongly attached over on the inside a little bit more, so we're going to go ahead and get this ready to fix. Here we're just removing a little bit of this tissue, a little bit of cartilage there to get down to good bleeding bone. So we have a nice repair. Just removing a little bit of bone right here. Really don't look like you have much in the way of impingement on your x-ray. So I'm not inclined to really take away a lot of bone. You might have a little spur right here, and we'll remove that just like this little burr. Just a little bit right here. Let's switch to a shaver and get it out that way. So here, just finishing smoothing this out with the burr. It looks pretty good. Again, I don't think you have a lot of extra bone here. I'm just kind of preparing this for the repair. Looks pretty good, so I'll show you what it looks like when we put the anchor in a minute.
It's got a lot of torque, so it's like a little sports car. But
so here we've got
the thing on there where
your anchor's your anchor in place there. Your suture's coming out. We're basically gonna pass it through your labrum with this little bird beak penetrating device. So essentially, we're just gonna penetrate your labrum with this. Just like that. Basically just come in and grab one of these stitches. Like that, and then pull it through. And my assistant hold the other suture, that one there. Yep. Alright, and that should be our first suture pass there.
There's a handle for that slotted cannula if you want it.
And you've got, see how that goes through your labrum nicely there, and is going to reoppose it as it heals back down. So here I'm tying my first stitch. It's coming in there. Basically what we do is tie stitches on the outside and then pull them into the joint just like this, and that's gonna fix that labrum back down just like that. Looks good there. Now bring in a couple other stitches. Yep, this is just like that. Two more. And our last one here. And then we're going to come in with a knot cutter. Just like that. I'm going to go through the same procedure and put one more anchor in, I think. So here's a look at your labral repair. It looks great. Okay, you can see how that's nice and tight now. There's the stitches. 2 stitches up top here from your labral repair. Okay. 1, 2 over here. They're kind of close to each other. But I can't really get that probe in there anymore. So I got that nicely repaired. I'm going to take one more quick look around to make sure I didn't miss any other tears, and then we'll be close to being done, I think. So it looks to me like you actually do have a small impingement lesion. You have this little area of pitting in the femoral head, and you can kind of see how there's a little bump that goes from about here to over in this area here. It starts to look more normal again. So I'm just going to take that down a little bit. So here I've delineated our impingement lesion right here, taking off some of the cartilage. It kind of ends right there. That's where the vessels come in. So we're not going to go any further than that. We're just going to remove this bone here with the burr. I'll show you how we do that in a minute. So here we've got our burr, and we're just removing some of this bone very carefully. Don't want to take away too much, but enough so that you don't have any more impingement, you don't get any more tearing of your labrum. I think this may have contributed to your labral tear, which is a large part why I want to kind of smooth that out a little bit. So this is what it kind of looks like after we've burred off some of this bone. Okay, I think we've taken care of this impingement lesion. Looks good. Okay, just shaping it a little bit. We've gone all the way down to the edge of the lesion there. Okay, taking it back to here, right about there, the femoral neck, over to here. I think this certainly was contributing to your labral tear. We're going to bend your hip up now pretty far just to kind of confirm that there's no more impingement. So let's go ahead and flex up. And there we're at 90 degrees, we're nowhere near impinging. It's about the limits of where we can test you on this table, but it looks good. Go ahead and bring it back down. So that's going to be it. I think this will take care of your problem. We'll see you back in clinic.